Global Head of Health Practice Dr. Farley Cleghorn, on a recent visit to Grenada, wants regional government to start preparing in the event that cases of Zika infection leads to the rise in babies born with microcephaly.
We have to live into that experience, and we have to set up the programs for babies born to affected mothers in order to understand how to deal with that. So we do have, of course, there's a natural incidence of microcephaly, for example. There's a natural incidence of anencephaly, which is babies born without a brain. They generally can't survive. But babies born with microcephaly, they have a spectrum of outcomes. It's like being born with Down syndrome. Spectrum of outcomes. Some are what we call good quality, some are not so good quality. And with microcephaly, it's the same thing. You have people who are on the lower levels of normal, but you also have those that will not survive their infancy.
Dr. Farley Cleghorn says increases in microcephaly cases has spawned the need for governments in affected countries to start setting up programs to assist babies born with the condition. He said the region must also follow suit in the event that this becomes a reality. Microcephaly cases were observed first in French Polynesia during the 2013-2014 outbreak and more recently in northeastern Brazil. The expert on Zika virus was a part of the 3rd annual Medical Conference Community Outreach Program held at the Radisson Grenada Beach Resort. Dr. Cleghorn spoke of the type of special services that will be needed to treat and care for microcephaly babies.
So you have to follow every child and mother, of course, a mother-child pair, in order to understand in the Zika outbreak what are the outcomes for these children. Which means, of course, you need rather complex care delivery. But this is both pediatric neurological services, as well as general pediatric services, public health services coordinated in order to follow these kids.
He said new infections emerge very often and there is no need to be despondent.
Stay tuned. I think there's a huge amount of information being generated by every country today. There needs to be coordination of that information. We have regional organizations like CARFA, like PAHO, like the WHO, all coming together to try to understand what the information is telling us, how do we respond, how do we react, and how do we coordinate for the future.
For GBN News, Raquel Sinclair.